To our first guest. We have a brand new service and facility at Henry Ford Jackson Hospital, the Milk Bank. And joining us today is Milk Bank Manager Erin McGreal Miller and lactation consultant RN Carrie Gray. Welcome to the show.
Thanks for having us.
Yeah, good to see you again. We got kind of a sneak peek of the Milk Bank a few weeks ago.
Yes.
And it's perhaps for many an unfamiliar concept, so probably should define what a milk bank is.
Sure. So Milk Bank is an organization that accepts milk from mothers who have more milk than they need to feed their own child. And we screen donors, we accept the milk, we process the milk, we pasteurize it, it goes through rigorous safety testing, and then once it's bottled and ready to be dispensed, then we'll be able to start dispensing milk to infants in need at the hospital here in Jackson once we're fully accredited.
And we're getting close, pretty close to that too.
We are.
So the Milk Bank, well, it is new. It's new not just here, it's new everywhere.
Well, yes and no. Milk sharing has been around for a long time. And HIMBANA, the Human Milk Banking Association of North America, has been around since the 80s. But there's been a resurgence in interest in this, especially due to the formula shortages. So I think there's a lot more attention around it now. And in Michigan, we'll only be the second milk bank in the entire state.
Wow.
And then throughout the country, there are only, I believe,
There's 31
milk banks in the country. So we're really pleased to be bringing one here to Jackson.
Yeah.
Well, that's pretty groundbreaking. You guys must be excited that Henry Ford Health chose Jackson in Central Market to be the location for the milk bank.
Very excited, yes. And it's been a process that we've been going through for a few years now, so we're excited to see it coming to a close and get ready to start up.
And it's a physical building. You're
It is.
standalone,
Yep.
bricks and mortar right here on East Ave.
Absolutely, yes. We're just completing renovations right now. It's beautiful, really state of the art. We've been able to purchase a lot of the best products that are available for milk banks, and we're really excited to have them here so we can offer the safest pasteurized donor human milk available.
Will you just be serving the Jackson area, or is it going to be available for anyone?
Well, to start, we're hoping to provide pasteurized donor human milk here in Jackson at our hospital for inpatients. And then as we expand, as we see how many donors are interested in stepping forward to donate and how much milk we can pasteurize and have available, we are really excited to expand that. We would love to offer it throughout the Henry Ford system and then also outpatient. What's going to be the real determining factor for that is how much milk we get from donors, how many people are stepping up to become screened and approved donors.
Supply and demand.
Exactly, it really is.
So, Carrie, we've got new moms that would be the patients that would be taking advantage of that are in the hospital immediately within a day or two after giving birth, right?
Yes.
So as lactation consultant, I think it's a regular thing. That's one of the things new moms will go through after before or close to the birth of their baby.
Right. Yep. And we offer it to all of our inpatient moms, and we also can send home some milk with them if they need it when they leave, just to help them have a little bit more when they go home. And then hopefully if they continue to need it, then we can start providing through the milk bank.
So when would a mom be using the milk bank? Is it at a point when they are not able to?
Some moms aren't able to make enough milk or make milk. Some babies are born very premature and need that milk from the milk bank. And then we can also use it. We have parents that do adoption and want to provide breast milk for their baby that they've adopted, and that's another way we can reach out to them.
It's a really personal decision
Oh.
on the mother's part or family's part.
It is.
and a decision that every family has to make. How will they feed their infant? And I know Carrie was just sharing with me the breastfeeding exclusivity rates here in Jackson, and
Yep, they're about 80%, and so we have a lot of moms that choose to breastfeed, and we're hoping they will continue to support us in the milk bank.
And even if
their
they do
journey.
choose to breastfeed, they might not be able to, it might not work out. I mean,
right.
And then we can help them in return with milk from
and they
other
might change
moms.
their mind halfway through. It's like, oh my gosh, I had no idea this was going to be, as hard as it is.
Well, and anecdotally, I've been hearing a lot of stories about people who maybe need a little bit of extra help in the early days after having a C-section. They rely on pasteurized donor human milk, and then later they go on to have an excess of milk and they want to give back, so they end up donating to a milk bank. So it's really neat to see how it can also come full circle.
Yep.
And I remember during the early days of the formula shortage, moms informally were just finding other people, and so this is a lot more safe.
Yes.
How do you, I've seen it, I know.
Yeah.
It's like a dairy.
Yeah, so it's the whole process starts with someone who wants to donate or is interested. So they start with the screening process. It is, I would call it a rigorous process, but we do try to make it as simple as possible and as convenient as possible for moms. So they need to fill out a written questionnaire. There's a verbal interview. They go in to have labs drawn. And then once we get the results of those, we just ask their healthcare provider to sign off to say that they're generally in good health, that they don't use marijuana or nicotine products. And from that point on, we can go through an approval process where Carrie and our medical director approve them as donors. And then at that point, we can start accepting milk. We're actually not at that point yet in our accreditation process. We're currently screening our first 10 donors, but we've already reached 10. So we know that we've got that interest, and that means we'll be moving to the next step, which is actually accepting milk. We'll accept it in frozen deposits. So storage bags of milk will come into the milk bank. And that's when we really start the process of pasteurizing it. And like I mentioned before, there are different points where we do testing, like bacteriological testing, to make sure that the milk has been pasteurized, that it's healthy for newborn babies who have underdeveloped immune systems. So it really is the safest option for feeding donor milk that's not mom's own milk to a child.
And I know moms, there are moms that say, oh, I really do like to do breastfeed my child because it's not, there's no chemicals, it's not treated, it's not homogenized or pasteurized or whatever milk goes through. That process does not alter the safety or the health of the milk itself, right?
Right. Yes, it does not alter the milk at all.
It's to kill bacteria, right?
Right.
Exactly. Viruses. It's the Human Milk Banking Association of North America, HIMBANA for short, gives us guidelines to make sure that we do kind of a gentle pasteurization that eliminates anything harmful in the milk, but leaves all those wonderful properties that we know breast milk has that are beneficial for a newborn.
Yeah, and I saw it's an incredible process, super spotless. You've got refrigerators, freezers, heaters, coolers. It's it really is. It's like a dairy.
Yes.
Now the moms that want to donate while you're not able to accept donations yet, should they get in touch with you yet, or wait until you're fully accredited?
They don't need to wait until we're fully accredited. We do have enough donors now for our initial group that will help us get through accreditation. But once we get approval from our screening process from HIMBANA, we'll be able to start accepting more donors before we're fully accredited. So we anticipate probably in the next few weeks, we'll be able to start accepting more donors. So if someone's interested right now, they can absolutely reach out to us by going to our website, or they can also just wait a little bit. And in the meantime, pump milk, make sure you label it with the date that you pumped it. And that's really the biggest thing you can do to get ready to donate.
How long is it good for?
So milk that is pumped today needs to be in a baby's belly a year from today. So it's 1 year. But we do, because of the process, we do have to limit how old the milk is that we can accept. just because there are lots of steps in the process. We have to allow time for screening, allow time for the pasteurization, allow time for the test results to come back. So we're thinking it'll probably be about 6 months is what we're looking at after we're accredited. We'd like to receive milk that's no more than 6 months old.
Yeah, it's pretty cool. It's like, yeah, and you have a chain of custody.
Yeah, we have to follow it throughout every single step, and we have to know exactly which milk from which donor ended up in which bottle.
Now, Erin, you said you don't want to and can't and won't accept milk from moms that are using marijuana or smoking. What about alcohol?
Yeah, but Himbana gives us guidelines for that, just how long you have to wait after drinking alcohol, and they give us the criteria for the quantity of alcohol and how long you have to wait. So we just share that during the screening process and offer education.
So we know, and you know, we hope all moms are, you know, observing that, you know, drinking and smoking during the pregnancy. But once the baby's born, they can safely drink alcohol, right?
A certain amount.
That's in moderation.
The guidelines that they
Yeah.
provide, yes.
But the marijuana and cigarette smoking, that will affect the milk and the
Yes.
baby.
It does cross over to the breast milk, so they don't want us to accept milk that has been.
And those moms, they shouldn't be doing that anyway.
Well, really, you know, that's a conversation for them to have with their healthcare provider.
Right.
But we're providing milk to babies who might be in the neonatal ICU. We have to make sure that we follow the most rigid guidelines. So, you know, I would say that they should just touch base with their healthcare provider about all those
Right.
other individual needs. But from our perspective, Himbana's guidelines are clear and we can't accept them.
Yeah, and I'm a man, and I am not really in a position to make any kind of you know, recommendation on what other people should do when I'm not in that mix. So, as you say, up to the parents
Right.
and their healthcare providers.
Right.
Well, it's pretty cool. It's very exciting,
We're very
It
excited.
is. We're so excited. Yeah.
and I know you'll let us know when everything's fully up and
Yes.
running.
Yes.
will.
Absolutely. Yes. There will be a ribbon cutting, and you'll be there, I'm sure.
Thanks so much.
Thank you.
Thank you.
Happy Easter as well.
Happy
Happy
Easter to you
Easter.
too.
Erin McGreal Miller and Carrie Gray from Henry Ford Jackson Hospital and the new milk bank.